Hi, welcome back, and thanks for joining us for our second part of the interview with John Oyler. So was Beijing the next step in your kind of journey? Was that
No, I built a company before this, Bioduro,
okay?
which was a services company that worked with other companies. And I did that because it's a lot like McKinsey. It's a lot like Telefia, which was this wireless mobile company I built. That's something where you get to meet all the senior people doing R&D in the industry, big company, little company, and learn from them and understand, what it takes and what's successful and learn who's really talented. And, it was really for me a way to get back into that space, but learn and build a deep network
Yeah.
and do something that was central for, R&D and science. So I think I knew if I did that for several years, my knowledge base, my ability to, do the next thing would be tremendous.
Yeah.
So,
And you'd get the top talent, right? You were meeting all.
and I know the top talent
Yeah.
because, I'd have been through that process and know people. Yeah.
Yeah. And so you did that for a few years.
Yes.
And then how did this journey to get to Beijing start after that?
Well, in doing that, I had asked people who some of the best scientists were, and someone had mentioned, our co-founder, Xiaodong.
Okay.
And they said, oh, absolutely brilliant scientist, understands how cells die. In cancer, cells never die. That's the problem. And, he's really one of the great young minds in science who is able to solve intractable problems.
Okay.
And, a lot of people can solve easier problems, but he's not afraid to go after the hard problems. And he has a great way of thinking where he's able to do that. And he actually was, mentored by the Brown Goldstein Lab, which are the Nobel laureates for cholesterol at UT Southwestern. And he's one of the younger ever Academy members for US Science Academy. And, just his reputation was incredible. Well, I'd interacted with a lot of scientists with incredible reputations and, Nobel laureates and everything before. And, that's important in our industry. But really for him, people talked about, he liked hard challenges and he was able to solve things that other people weren't. And that really made me say, I want to meet this guy. So I stopped by and asked to meet him, but he wasn't there. And when I was building the services company, one day I was sitting there in my office and, I knew everyone in our company and I had a tiny office with a glass wall that I could see everyone. We had security. You weren't allowed in without a badge. You had to sign in and sign out. It was serious stuff. And this one day someone wanders in and they don't have a badge on. Like, who is this? Who is this person who wandered in? How did they get past security? And I'm angry because I'm like, our system isn't working. I'm angry. I'm like, who is this person? I don't like this person. And they look around and they see me and they walk over and they knock on my glass door and say, are you John? And I'm like, yes, I'm John. And they said, I'm nice to meet you. And I didn't catch the name. And I shake the person's hand. I think we've all been in a conversation where you don't actually recognize the person you're supposed to, and you're trying to fake it. So I'm faking it as long as I can. And he's talking to me and I'm like, first of all, he looks 10 years younger than me. He's wearing tennis shoes and jeans and like a polo shirt. And secondly, he's like the most unassuming person you've ever met.
Okay.
And I'm thinking like, is this a like fresh PhD that's trying to get a job in the lab?
Yeah.
And I'm thinking, does this person, is it somebody that we're doing work for and they're stopping in? I'm like, who is this? What do they want? Like, what do they want? I don't know. I'm 15 minutes into talking to him. I still have no idea who he is. This young kid, much younger than me. And I'm like, so I don't know, but I actually like him. So he's turned me being angry with the situation, angry with him to, I really like the guy. And then a little longer, maybe 5 minutes later, I'm like, he's really funny too. And he's smart. And I'm like, but what does he want?
Right.
And like, why is he here talking to me? And I have no idea. I probably talked to him 35 minutes before it finally dawned on me it was Xiaodong, and never in a million years, because he looked so much younger than his reputation. I mean, his reputation was much bigger than his age anyway. By the way, he is much older than me in retrospect, way older than me. No, he's not, just a few years. But I absolutely realized this is a really special person. They're humble, they're brilliant, they're funny, they're kind, they're smart. And he just stopped by to say hi because I had missed him when I stopped by to see him. And I thought, I really like this person. I'd love to find a way to work with him in the future.
And you knew you had a friend if anything, right? Because you
Yeah,
would like to.
he was wonderful. And maybe 2 years later, when the company that I was building, was kind of sold prematurely by the owner who got in trouble in the 2009 financial crisis, he called me up and literally he said, "John, I heard that you're unemployed. I should go to dinner with you and let's talk about things because there's an investor that's interested in having me start a company. And I'd love to." And he actually said, "I should recruit you as the CEO because you don't have a job.
Yeah.
And I know you don't have a family. And I know I didn't have my family yet. And I know that you don't have a home. So, you're mobile. You can do anything." And I said, "Okay, happy to go to dinner." And we went to dinner, and we talked about the opportunity he was looking at. And, he said, it's actually a really good investor. And the investor was new. It was a new fund. And he said, the investor will put in $10 million. And I looked at him and I knew the cost of things in biotech. I was like, $10 billion can't do anything. And I arrogantly said, I can put in $10 million because I had like $10 million and 4 cents
Okay.
or something like that to my name. And, I was just like, there's not enough money. If you do that, we'll run out. We'll only get to try one thing. And, I'd been through these other companies that you build and then they're sold, and I hated it. It's like you have children and you raise them and suddenly, you have to put them up for adoption. It's terrible. And so much energy goes into pulling a team of really brilliant people together, figuring out how to work well together and becoming highly efficient. And you do all that, and right when it's all massively humming, then it's gone. And like, that's just not, I didn't want to do that again in my life. And I said, I want to do something. I'd love to do something with you, but I don't want to do something unless we're really going to do great science. We're really going to have huge impact, and it has to be lasting. And I said, I want to build something that my kids, I had no family at the time,
Yeah.
and my grandkids, can see and have as their legacy. And I want it to be something we can all be proud of. And, he's like, "Oh my God, I want to do this with you. I don't know how we're going to do it, but we have to figure it out." There was lots we could do and lots of people we could hire and lots of things, but we actually spent several months trying to say, if we're going to build a company, how are we going to do it differently so that actually it can last and it can have that impact and it can do that great science?
And you knew the R&D, you knew a lot of the good R&D leaders and scientists at that point. So was it easy to kind of go out and find them and bring them into this company once you realized you two wanted to do this together?
When we did, we had a lot of things going for us in the beginning. One of the things going for us was we definitely knew great R&D people. The other thing going for us was Xiaodong had quite a reputation. And the company I'd built before had a very good reputation with many people in the industry, including with US Merck. So as we started the company, we were able to, in the beginning, raise $20 million from US Merck. We were able to raise a few $1,000,000 from some angel investors. And I, of course, had said before, I'll put $10 million in the company if we need it.
Yeah.
And sure enough, later on, we needed it. And everything that I owned except the 4 cents, became invested in the company.
Yeah.
And so, that was the outset, which is a decent amount of money to start with. And as we got started, we built 2 teams. One of the teams that was built was doing research. The other team that was built was doing clinical
Okay.
science. And, when we stepped back and said, how are we going to be different? I think we had a few views. First of all, when we do science, it has to be outstanding and we have to make impactful medicines, but everyone's trying to do that. But really, one of the things that we figured out early on was the biggest problem in the industry is really clinical trials. And at that time, a lot of people thought research isn't working. We didn't agree. We thought this is going to be the most prolific next couple decades you've ever seen because it's all about to work. Like you could feel it. If you really knew it, you could feel it. It was about to break in a huge way. The research was going to be impactful. But even with that, what we realized looking at this, and it's because we stepped back and we said, how are you going to build something sustainable? We realized 90% of the time and 90% of the money spent is spent on clinical trials. And even when you take a pill, when you get an injection, if you really look at all the cost that goes in that to deliver it to you, everything, it's still probably 75% of the cost is clinical trials.
Yeah.
So why? Largely clinical trials have been run in the same sites in the same countries for decades. Only 5% of patients in the US ever will enroll on a clinical trial if they're a cancer patient. And all the science is breaking, so there's all these questions to ask, but we still have a fixed pool to run clinical trials. And really, we're running them in the most expensive centers in the most expensive countries, and that's all.
And the timing for it, using some of these external, it takes it a
It's
lot longer.
Well, it's backed up
Yeah.
because there isn't a big enough pool of patients is the problem no matter what. The secondary problem when you get into it is most of these trials, for some reason, even though this is the most important, it should be the core competency of the industry's outsourced this to a handful of CRO companies that run all the trials. And those companies do quite well, but they only work in these centers. And when you ask them to go to another center, their answer is, we'll go to another center, but you pay all the upfront cost, which we did. We asked at one point, can you go open a site in Thailand? There was I think it was a Harvard medical trained breast cancer
Okay.
clinician there. Brilliant. Tons of patients. And they said, yes, $2 million, where we could open another site in Australia for 20,000.
Wow.
It made no sense. It was in English, either place. It
Yeah.
was the same everything. You could fly someone there to stay for 2 years. Like $2 million made no sense. But that was the cost in doing it. So you never had this expanding clinical trial pool. And I think what we realized is if we want to change this, we need to do 3 things around clinical trials. The first thing we need to do is work with centers that these CROs don't go to. Work with centers here in the US, build more and more people. Work with centers all over the world. We started in Australia, Korea. Work with new places. Brazil and South Africa are 2 that most recently we've built a lot of capabilities in. But go to places other people haven't, whether it's here in the US, whether it's in Europe, whether it's geographically, and bring more people in. And by the way, when you do that, once they have a little bit of experience, you're providing an unbelievably valuable service for patients in the industry. It's like when you teach someone to fish versus giving them a fish. Now they can fish, and now that's there for the industry, and we're expanding the capacity. So this was part of what we wanted to do, be able to go places other people couldn't. The second was cut out the CROs because they prevent you from doing that. They add additional cost, and everyone's unhappy with them because they create this extra, operator communication between the clinician who really wants what's best for patients. Their whole life is dedicated to
Yeah.
what's best for patients, and a company who wants what's best for patients. But you have a profit entity between them whose sole goal isn't what's best for patients. It's a services business. It's different. So we wanted to eliminate that. And the other piece is we're in the world of technology. The way clinical trials have been run is manual double entry. a lot of times the data, which is in the hospital system, the second it's recorded, takes months to show up in the database, which has to be manually entered. When it's manually entered, anytime you manually enter anything, there's a 5% error rate.
Yeah.
Then you got to double check it all. You got to source verify it all. It's this huge extra amount of work that in today's world, with all the technology we have, this should be near instantaneous. It should be as error-free as possible. And it's not hard. And this is the system that's being used by this industry to understand, is a medicine safe and efficacious? It just needs to be changed. So that was our commitment in the beginning. We're going to be very different. So on the clinical side and the research side, we built a research site, and that was spectacular. And on the clinical side, we began with the intention to run trials in Australia and in Korea
Okay.
and in Taiwan and in Hong Kong, and complement that with J&J, who we licensed a couple products from, running trials in the US and in Europe and in Japan. And that was the beginning of things. And so we actually built a clinical site that was being managed out of Philadelphia, and then a research site. And the two of those were our initial inputs. And from the beginning, it was a huge commitment to research, but also fundamentally, we have to change this clinical trial piece. It's the key to everything. And we really need to build that ourselves.
And when you were thinking about Australia, were you thinking about the diversity of the people you're going to get in clinical trials in Australia, since it's such a multinational?
Honestly, no. When we thought about Australia, the reason we went to Australia is it was the fastest to get trials started. And like everything where there's new technology, it's all about speed.
Yeah.
So there was a real ability to move quickly there. The clinicians were really good. And we quickly became the largest oncology clinical trial sponsor in Australia, which was spectacular. And I don't know, we probably have roughly 200 people around this time doing just clinical trials in Australia.
So you have your R&D team, you've got clinical trials, you brought that inside and internal. It's all going great. What do you kind of see for the future vision of the company at this point?
Well, so we got a lot of things right. The clinical trial piece is absolutely key. And today we have 3,600 people all across the globe in our own team running clinical trials. We got that right for sure.
Okay.
We're better quality, we're faster, lots of examples of that, much faster. And we're lower cost than other companies. That's a huge advantage, where you spend 75% of the money and 90% of the time. In addition to that, we have an incredible research team. That isn't a surprise to us. That's having huge impact. And, what it's able to do is unbelievable. I think what Xiaodong and I didn't know at the time is how strategically important commercial was. And we learned along the way, and how important manufacturing was. Because again, manufacturing for a small biotech company, you're reliant on third parties. And many of the things we learned, we didn't learn because we're brilliant. We learned because we learned it the good old hard way. And from that perspective, you made a mistake, but you learned from it. And the other reason, Beijing is able to be so fast and so high quality is we have now built our own manufacturing. Most recently capped off with this, $800 million biologics facility and clinical site in Hopewell, next to Princeton, New Jersey. And that's really lets us do a lot of things, faster and lower cost and more flexibly than most companies in this industry. So that's exciting.
Yeah. I had the opportunity to go to that facility, and I've never seen more happy employees. Everybody is so thrilled to be in this new kind of modern facility, and it's really a great culture there. So
I think across the world, we've built great facilities from that perspective.
yeah,
Research, manufacturing, no question. The only site that we're not so crazy about is the San Mateo site, which we're in today, which we were forced into at the beginning of COVID when our landlord kicked us out. That's a reformed WeWork space.
okay,
And the reason we don't like it is it's not open, and it makes it hard for people to collaborate. It
yeah,
physically doesn't fit with the way we want to work.
yeah, that makes
So
sense.
hopefully we will be moving on. And maybe at the time, people are listening to this, we'll be able to announce that we have a new site here in the Bay Area, which is spectacular. And actually, at that site, we're going to have research, which is very exciting. And we look forward to that.
Tell me a little bit about your wife and daughter, how, you talked about how proud you were of your father and his work ethic and your mother, working at this nonprofit. What is your daughter? What do you think she's thinking about you now? Or, she's seeing her father build this company that's you're saving people's lives. And do you think that she understands that at this point?
Well, she's been dragged all over the world from the time she was an infant.
Okay.
And I can remember when our company IPO'd and did our NASDAQ IPO, I came back to the company and we had a town hall. And in the town hall, our CFO at the time, who she referred to as Crazy Uncle Powered,
Okay.
who is the most normal person ever, was talking about the IPO and then introduced me. And I walked up the stage to say something. And right as I did, everyone quieted down, except for my, I don't know, 2, 3-year-old daughter who said, "That's my daddy. He's crazy." And everyone laughed. And so I know my daughter thinks I'm crazy, but hopefully crazy in a good way. But, she's, been through a real wild experience and all stages of this company. She's comes to the office a bunch. She's been to many of our facilities all over the world. She, during COVID, actually would come in and sit under my desk and, listen to many conversations, very, senior and executive, very benign, very banal. And it's remarkable in retrospect, things she'll bring up later and ask about, like, you talked to this person. Why were they nervous when you talked to them? It's very interesting, this, set of experiences that she's had. I can remember one call I did during COVID. And when she's making too much of a ruckus, I just try to ignore her. But one call I did during COVID, she proceeded to break out 2 bottles of like leftover baby powder we had from when she was wearing diapers
Okay.
and decided to make it snow on top of my head. And I just kept talking and I was presenting and I just kept getting covered with snow. And
Yeah.
I just
Too
acted
bad you
like
didn't
she wasn't.
record that. I think she'd appreciate that when she gets older.
I wish we had recorded, but I can tell you in retrospect, it's impossible to get baby powder out of anything. So please do not recreate that at home. It is a very bad cleanup. But in terms of the family, look, I was really blessed to meet my wife, Victoria. She's a wonderful person who, has dedicated a lot to our family, but also a lot to the company. She is so smart and she's so detail oriented and she's so focused on, how do we do things as well as we possibly can, that she's a big driving force behind what I'm able to do and what I'm able to accomplish. And I think that she's, loves the fact, as does my daughter, that we're doing something that's helping people. And I think unquestionably, they both know that and they feel that, and it's really important to them from that perspective. With my daughter, I know she wants to help people. She also wants to help animals. And I know she has a very strong sense of justice.
Yeah.
And she's really interested in history.
Okay.
But last time I asked her what she wanted to do, she wanted to be a geologist or a librarian.
Okay.
Although that's not true. The most recent time I asked her, she wanted to raise puppies.
Okay.
But I think that with certainty, probably what she wants to do will change over her life. But she is sure she does not want to be the CEO of a company. That's the one thing she's sure of.
Surprised that not
No interest.
sitting under your desk and like listening to your conversations and stuff. I thought maybe that would inspire her to want to be
No interest.
no interest. Okay, that's interesting. Well, she's getting a lot of good experience if she does if she ever does decide to do that. So I've worked at a lot of pharmaceutical companies, and a lot of them had that patients are everything that we're thinking about and doing. But I've been to our European offices, I've been to our Hopewell, New Jersey office, I've been to this office, and everyone I talk to, really everything that we're doing every day here, it feels like we're all talking about we're doing this for patients. Do you do you ever kind of stop sometimes and think about the impact and how many people that you have saved from what you've built, what you and John Donald have what you've built? Like, have you ever stopped for a moment and kind of like taken that in?
I don't know. It's in one way, yes, but in another way, very important in setting up this company is, one of our former board members, Don Glazier. And this year we lost him to cancer. And it's terrible. I've had 3 other people close to me recently, who are going through this. And I think, every day we live longer, the network we have that's facing these challenges only increases. And so a little bit I think about, how proud I am of things that the company's been able to accomplish. But I think I very much see, how much need there still is. Yesterday, I spoke to someone during my lunch, who lost his sister at a very young age to glioblastoma, who has another, close friend of his whose daughter is going through likely a very similar disease and tragedy. And you look at this, it's horrible. And even in CLL, where in CLL, you know, we're developing 3 great medicines, one's approved, but, you know, there are medicines. No one should be on chemo. Everyone should be getting treated. And, you know, our BTK inhibitor isn't approved in a lot of countries in the world. It's not available. And you look at PD-1, from a PD-1 perspective, many countries, there's no PD-1 approved. And if there is, it's completely unaffordable. And this is a tragedy because the science is there. The medicines have been proven to be safe and effective. And by the way, the cost of goods sold, we didn't say 75% of the cost is the cost of goods sold. We said 75% of the cost is the clinical trial piece, which is all up front. That means the cost of goods sold is very small. If you compare this to something like, what Tesla's doing, the cost of goods sold is huge. It's the vast majority of the price. This is not like that at all. So why, if we're able to manufacture so well, and that's part of the reason controlling your manufacturing really helps, you can really drive down the cost, but the industry is good at this now. Why can't we get those medicines more affordably to people in other countries? We can probably do that many places. Maybe the poorest third of the world, it's charity. But probably everywhere else, you can even more than break even, create a little bit of profit.
Yeah.
Not as much as in the United States or Japan or Europe, but even if you create a little bit of profit there, say you create 10, 20, $30 million in Latin America, that still is a revenue stream that pays for this upfront cost. And if you can do that and apply that, even if it's much smaller margin, much smaller number, if that can come back and help cover the upfront cost of the clinical trial, prices can be lower here in the US. And, we do what we say. When we launched the BTK inhibitor, even though we have superiority in safety and efficacy over the first BTK inhibitor, we launched at over $30,000 a year lower price. We didn't have to. Other companies wouldn't have done that. The fourth BTK inhibitor to be approved was actually priced over $80,000 a year more. And it has no superiority data, from that perspective. So, we are acting in a way that is very different. And, that's the goal. The goal is everything's going to be done differently in this company. And if we're able to do that and we show that it works, still has to make money to fund more and more research. But if we show the industry this works, the industry will change its business model and follow us. And that doesn't just mean we brought our medicine, effectively and affordably and accessibly to more of the world. It means we help transform the whole industry. So the entire industry does this. That's real impact. That's really something that, your children and your grandchildren and their grandchildren not only can see and be proud of,
Yeah,
but can benefit from.
that's pretty
And that's
amazing.
the hope.
Last question is, if you had one goal that you haven't reached yet, what is that one goal that you want to accomplish?
If I had one goal,
What's your main goal, I should say? I know you probably have a lot of goals, but what would be the one goal that is kinda at the top of your list that you wanna make sure you accomplish?
the primary goal at the top of my list is to be half as good of a parent as my parents were to me.
That is pretty awesome. Is how does your dad must be so proud of you is whenever you go back and see him. Is he
I'm sure he's proud of me, but he's also full of suggestions and comments. And, when we don't do things well, he's like, here's a better way to do things. But, he's someone that, I talk about everything with. And love to have any moment I can to speak to him. And I think that he's, full of insight and incredibly helpful, to me as a thought partner on many things. And I think, one of the things I learned in my life going through tragedies and going through other stuff is I think when we're young, we think when there's something bad happening, don't tell the people you really love because you don't want them to be worried. A lot of people do this. Like, I'm going through a problem. Don't tell my parents. I want them to think I'm happy. But like the truth is, that's when you need your parents the most. And a couple times I did this. And in retrospect, after I got through everything, I realized what a wasted opportunity that was. And, you're unhappy. They don't know what's going on. And like, I really believe, your parents just want to help you.
Yeah,
And, the more honest you can be with the problems you have and create that dialogue, by the way, then they're a parent and they feel like they're helping you, even if it's tough. That's what they want to be there for. They don't want to learn later you went through something terrible and you didn't feel close enough to like talk that through with them. So I think that was a big change in my life at one point where, the hardest things I face, I'm talking to people in my life about because, we all need help. None of us are successful alone. We're only successful together. And the people you love the most, they want to help you. Don't shut them out. So
that's great. Thank you so much for being on, John.
sure.
Your history is amazing to hear, and I think people are really gonna appreciate how you've built these mini companies and you learned so much going through your college years on how to be an entrepreneur. So thank you so much for being on the podcast.
Thank you. Appreciate it. Have a great day.
Be sure to follow us and subscribe to our podcast on Amazon, Spotify, Apple, or iHeart. You can also subscribe to the video version of the podcast on YouTube. Thanks so much.